Start now. So we start with something we all want to learn now. So after hearing about cancer for so long, we want to prevent cancer, right? So that's where we come to immunoprevention. You are using the immune system to prevent cancer from happening. So you all saw how important is immune system. Cancers can survive because they close our immune system. So if we keep our immune system active, we can actually prevent cancer. So this is showing you immunotherapy strategies. You guys know about PD-1, PD-L1, CAR-T, CAR-M therapy, cancer vaccines, monoclonal antibodies. You can also use these to prevent cancer. So immunoprevention approaches, the best one is prophylactic cancer vaccines. You take cancer vaccines in advance, right? Some of you have been giving me ideas about vaccines, and as I'm putting together the lectures, actually your ideas have been realized here. So even if they are realized here, you came up with this idea, so they are original ideas. Somebody just did it. So that should give you a lot of confidence that you're thinking in the right direction, right? Because you're just learning about it, and that's how you're suggesting new ideas. So cancer vaccines are available for many different kinds of cancers, particularly those which are viral infected cancers, okay? Then surprisingly, inflammation is a very important thing for cancer. So, these headache medicines that you take, aspirin like that is also cancer preventive because you are killing inflammation. So the root cause is that you should never have an inflamed tissue for very long, okay? That's very bad news. And there are other anti-inflammatory therapies. So we know what is cancer immunotherapy. We know you harness the immune system to detect and eliminate cancer because tumor upregulates immune evasive mechanisms. And you know about PD-L1, PD-CTLA4 therapy. You know about CAR-T, CAR-NK, CAR-M therapies, cancer vaccine, cytokines. So immunoprevention is preventing cancer by priming the immune system before disease comes, okay? So includes vaccine against oncogenic viruses. So especially if you are going to visit some countries where there is a chance of getting infection, right? So your immunity is very high being in India, but when people come from outside and if they're exposed to something for which we have natural immunity, then they may get a disease, not necessarily cancer or something, but so if many times we take vaccine before we go out elsewhere, right? This is to prevent a disease before it happens, okay? So reducing the risk of cancer. So you can take vaccine. So it is very common to take HPV vaccine against cervical cancer, Hep B vaccine against liver cancer. So liver cancer can occur due to Hep B, Hep C. So if you take the vaccine, you can really prevent that disease. It's just very effective. Chemo prevention. You guys know tamoxifen is a breast cancer drug. So people who are prone to have breast cancer, they have a family history of breast cancer, they take tamoxifen in advance so that they don't get it. Look at that, aspirin is one of them, okay? So, and then, people who have BRCA1, BRCA2 mutation, please remind me, Venkatesh, you asked me about BRCA1, BRCA2 and radiation and olaparib therapy. So we'll discuss that also today. Remember you were saying, so whenever olaparib therapy is given, it is followed by it is always accompanied by chemotherapy and radiation therapy. Chemo or radiation therapy because you have to damage the DNA. But I found even when it is germline mutation of BRCA1, BRCA2, usually one allele is there. But in tumor, both alleles are lost. Both copies are lost, but the human being has still one allele. So that's why it is more damaging to the tumor cells. Okay, so if somebody has BRCA1, BRCA2 mutation, you either remove the breast completely, that surgery is called mastectomy, or you remove the ovary, that is called oophorectomy. Okay, so like Angelina Jolie, she got rid of the ovaries, fallopian tubes as well as the breast because she was at very high risk of these cancers. And then the lifestyle intervention plays a very important role. No smoking, limit alcohol, healthy diet, regular exercise is the biggest chemo prevention for cancer. So this is the lifestyle thing I am writing. So maintain a healthy weight, eat vegetables and fruits, be physically active. Okay. If mothers are breastfeeding their children, it reduces the breast cancer chance tremendously. Fast foods are very bad, like McDonald's kind of food. It's a joke, like McDonald's kind of food. French fries and all of these things are very bad for your health. Red meat is very bad. Alcoholic drinks can lead to liver cancer. Okay, and Coke, Coca-Cola or Sprite or any of those drinks, they are loaded with sugar. They are just pure sugar. If I go to my dentist, there is a picture, instead of soda, you are actually eating sugar directly. It's that much sugar. So it is extremely bad. It's just like sugar hidden in the form of cola. Okay, so you have to limit that thing. So this is just showing you how cancer progresses. So these are healthy cells. The cancer, one cell has initiated, now it is forming a hyperplasia. These are different stages. Okay, now cancer has properly formed. Now it is becoming invasive. It is going, and now it is metastasizing to the bloodstream, and then it goes and lodges somewhere. So immunoprevention can be done before cancer forms or at the early stages of cancer. Once it becomes metastatic, it is metastatic. Then you are just doing therapy. There is no prevention there. But you can prevent it from progressing further. Okay. So based on that, there are three kinds of immunoprevention: primary, secondary, and tertiary. So primary is that prevent disease in healthy individuals. So people who get surgery done, ovaries removed, that is preventive surgery. They are just high risk of cancer, but they don't have cancer as yet. So that is preventive. Okay. Secondary is that they have precancerous lesions. So they have small lesions, like little bit of this kind of thing, but they are just really taking proactive things. Many times people go for some kind of test and they have some kind of polyps in the rectum or in the intestine, and so these are just benign lesions, but they are proactively taking care of that. That is also prevention. Tertiary is that, you know, the person had cancer, but now they have gotten rid of cancer, but they are taking preventive therapies so that the cancer does not come back. Okay, so that's what it is. Primary, healthy individuals, but at risk. Who are the people who are at risk? BRCA1, BRCA2 mutations. People who are smoking, or people who are not smoking but working in bars where other people are smoking. So they are at high risk of cancer. Okay, so and then these are some diseases. Lynch syndrome, these people have, if they have Lynch syndrome, they have high risk of cancer. Okay, and once the cancer is developed, like colon polyps, if they are there, you know, it can go to cancer. So this is actually, this can be treated at this stage. Okay, so this is, so so viral infected cancers are very easy to treat for prevention, not treat for prevention, because these are, we know the viruses cause that. So we have vaccines for those. And if we give the vaccine, the person is saved, right? That person may not develop cancer. So for this HPV virus, it gives rise to liver cancer. So we have different vaccines. So these are given to people who do not have cancer. HPV1 VP, it is approved. You give the vaccine, and even if HPV virus attacks, they already have the immunity against it. So this will not develop into cancer. But at lower stage also we have a vaccine which can be given. This is slightly different vaccine, you can see. So this will recruit all the immune cells because it's a vaccine, and then we can treat it at this stage. For high grade also there is a vaccine, it's a cancer vaccine, right? We know about the cancer vaccine used for therapy. But this is the preventive one. These are the treatment ones, okay? So immune system plays a very important role, and that is why immunoprevention is very important. So you guys already know about innate immunity and adaptive immunity. T and B cells are the ones which come in the adaptive, right? They make the antibodies. B cells become plasma cells, secrete antibodies. Okay, so these are the adaptive ones, these are the innate immunity ones, which we already discussed. So biomarkers play a very important role. How do you know these people are at high risk, right? Some people are healthy, they still take vaccines, especially if they are going somewhere where there is a chance of getting infected, they will take vaccine in advance, right? So people who are doing, they go in jungles, or they do, they do archaeological kind of work. So you don't know what kind of things you are going to get exposed to. So they are preactively taking all these vaccines. So traditional approach, this is the traditional approach. You have high risk patients, you have two sets of high risk patients, but treatment works for them, it doesn't work for them, and that is determined by the biomarker. Okay, and you already know about the precision medicine approach where the biomarker testing is done. So I'm going to tell you about 6 different ways by which we can prevent, we can harness the immune system, because this is not prevention of cancer, this is immunoprevention, that we are harnessing the immune system to prevent cancer from happening. So cancer vaccines, and we already know about this one, you have seen this picture. There are many kinds of vaccines which you can make, both as therapeutic after cancer occurs or preventative vaccines. So look at these viruses, these are well established viruses which lead to cancer. So HPV leads to cervical cancer, EB virus gives Hodgkin lymphoma, human T lymphotrophic virus gives to T cell leukemia, this virus to Kaposi sarcoma, Hep C, Hep B, they give to SCC, hepatocellular carcinoma. Okay, so now we know about this thing. So about 30 to 50% of all cancer cases are preventable. That's good news. 50% of cancers can be prevented. So cancer causing infections such as Hep B or HPV are responsible up to 25% of cancers in low and middle income countries. Vaccines are available for this and some types of HPV. So if you give it to them, you can prevent the disease from occurring. So that's really good news, right? So, so what happens when you give vaccine? You guys already know it, but I still want to go through this once again. So when you give vaccine, right, you are taking tiniest antigen of that virus, right, which is not going to do anything except trigger an immune response in your body. When it triggers immune response, B cells will form antibodies, right? So when B cells, so first T cells will get activated, then B cells will get activated, and then they will provide you with the antibodies, right? They provide you with the antibodies. But if they just give you antibody one time, it is no good. So then what they will do, some of these antibodies will become memory antibodies, and they will be stored for long-term storage, right? They will change the kind of antibody. So the epitope will remain the same, but now you prepare a different kind of antibody, which is a long-term antibody, and that will be stored in our body. So initially you will make rapid for the immediate clearing of virus, and then you save some of those for long term. So anytime that virus infects again, you already have the memory antibody, and they will rapidly proliferate, and very quickly they can attack the things. So these are the memory ones, okay, which are stored here, okay, and these are rapidly stored. So that's how immune response works. So what is memory immune response? So after when the adaptive system encounters an antigen, after the initial response, a fraction of these cells becomes memory cells, which remain in the body for years and decades, okay. So these memory cells can respond faster, stronger, more specifically than the first encounter. So when we were kids, like when we were born 2-3 months old or 15 days old, we got several vaccinations, one after the other, and we still have that immunity within us because of these memory T cells. Okay, so cancer immunoprevention aims to prevent cancer before it occurs by training the immune system to recognize and eliminate precancerous cells or oncogenic viruses. Okay, so virus like HPV virus or HPV virus. Okay, so HPV vaccine prevents cervical, anal, head and neck cancer, so many of them. HBV prevents liver cancer. Liver cancer is pretty bad. Liver is a very important organ. Okay, so these vaccines create immune memory. So if the virus appears later, our body is ready to fight it off. Okay, neoantigen based or tumor antigen vaccines. So some cancers develop from known mutations like for KRAS, G12C, G12D, all of those mutations. So we have made vaccine against them too. Okay, and if you give that vaccine, if that comes in, then those B cells, those antibodies can clean up those tumors too. Okay, so memory, so we have also made against these guys, EGFR receptor, it is expressed in which cancer? Lung cancer, very good, and breast cancer. Okay, so vaccine can expose the immune system to these antigens early, creating that CD4, CD8 T cells, and they will. So people who have Lynch syndrome, BRCA1, BRCA2 mutation, strong family history, chronic inflammation, these people are extremely high risk for cancer. So there are two kinds of antigens, tumor associated antigens and tumor specific antigens. So tumor specific antigens are neoantigens which are only expressed in tumor cells, and tumor associated antigens can be expressed at low level in normal cells also. So ideally you want to go for tumor specific antigens to have a very strong response specifically against the tumor. Okay, so this is just telling you that when you give vaccine against, or you make against a new antigen which is a tumor specific antigen, then you will spare the normal cells and you will kill the tumor cells. Okay, so cytotoxic T cells will find those antigens and they will kill the tumor cells, and they will recruit other B cells, will make the antibodies, and antibodies will bind and kill the tumor cells. Okay, so this is the difference between tumor specific antigen and tumor associated antigen. Tumor specific antigen, as the name suggests, is present only on tumor cells. These are TA are present in normal cells also, but highly expressed in tumor cells. So normal cells have small amount, tumor cells have a lot more. These are usually mutation of like R12C mutation in RAS, KRAS. So that becomes tumor specific, because anytime you have G12C or G12V or G12 mutations, that will give rise to cancer. So that is a tumor specific one. Okay. So this is mutant P53 RAS viral proteins, and they have a very strong immune response. If you make a vaccine, there will be a strong immune response. T cells, B cells, all of them will get activated. So TCA is tumor exclusive, tumor specific, better target for immunotherapy. TAA is also expressed in normal cells, although in small amounts. So this is, you don't want to use these when you're making immunotherapy. So neoantigen vaccines are good because neoantigens are specific for tumor cells. So what you do, first you have to find the neoantigen. So you do the sequencing and then you will make a peptide. See, this is a tricky part, okay? So suppose even if you know KRAS mutation is there, what part of KRAS would you make? So these programs can detect if you make this sequence, that will be highly specific. And then based on this, you make a vaccine, then you inject it, and then the body will take care of the rest, okay? You guys already know about immunoprevention by immune checkpoint modulation. So you give PD-L1 and PD-1 therapy in advance, the person who is likely to develop. Tell me a case when a person is likely to develop, but he or she has not inherited from the parents. Who can be the other group of people who are highly likely to develop cancer? Exposure to chemicals, exposure to smoke, exposures to radiation. So these people, or exposure to some kind of viral infections. Suppose you are working in a hospital with the patients who are infected. I mean, you have to take all the precautions to keep yourself safe. Okay, so you already know about the checkpoint modulation, CTLA-4 therapy, those kind of things here. CTLA-4 here, right? PD-1, PD-L1. Okay. So immunoprevention by checkpoint modulation restore T cell surveillance, because T cells are shut off by PD-1, PD-L1. So if you take that therapy, they are always active. You have memory T cells, remove early transformed cells. Transformed means cancerous cells. The cells which are at the early stage, if you remove them early on, they will not form the tumor and halt progression of pre-cancer, and you get long-term immunity. Okay, so you target high risk population. This strategy focuses on individuals, of course, with a genetic risk of developing specific cancers, BRCA1, BRCA2, P53 mutations, all of these things. Okay, so preclinical evidence has shown that in mouse models, prophylactic, which means preventive immune checkpoint blockade, can significantly delay tumor formation. So one can, if the person is at high risk, they can preventively take PD-L1, PD-1, CTLA-4 therapy. The body is healthy, they can deal with the side effects also of the immunotherapy. Okay, all right. So this is, you already know this very well, PD-1, PD-L1. So I'm not going to tell you about that. Okay. So mechanism of cancer immunoprevention by checkpoint modulation. So T cells get exhausted. Why? Because they become quiescent, because PD-1, PD-L1 get locked and T cells shut down. So if you do the PD-L1 therapy, T cells are re-energized. So when T cells are energized, if there is anything wrong, any precancerous cell, they will be removed and they will not form the tumor. Okay, then B cells will be active against them, they will make the antibodies, clean up the whole system. Then they will keep the memory cells, so the tumor can never form again. Okay, so and breaking immunosuppressive environment, so you can clear the immunosuppressive environment. So that is a very good way to keep cancer at bay. Okay, so now let's come to, this is what you were saying, Shivani, right? Monoclonal antibodies in immunoprevention. So that's where they come into picture. So you guys know how monoclonal antibodies work. What's the difference between monoclonal and polyclonal antibody? Can you tell me? Anyone? How do you define an antibody? It is a Y-shaped molecule, but what does it do? It binds to the target. And the part where it binds, what is it called? Epitope. Or epitope, it's called epitope, it binds to this epitope. So polyclonal, this is a protein. Polyclonal antibodies are many different species of the same antibody, which is recognizing different part of the same thing. But monoclonal will always bind to the same epitope. It's against only that one epitope. Polyclonal are just attacking many epitopes. Make sense? So if this is a protein. So if it has polyclonal, it has different species. It will bind here, 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 here. So it's a mixture of antibodies, but they are all targeting the same protein, but binding at different site. So it's a mixture of antibodies. Polyclonal will just bind at one side. So, monoclonal will just bind at one site, and that only one site. So every species will only bind at that one site. So that is monoclonal. Okay, so that's what it shows, monoclonal. It is showing you like this, but they are identical. These things are identical. Okay, and once attached, either that whole thing will not work, or it will trigger immune response and all other cells will come and eat it up. Okay, so this is a monoclonal antibody. They are binding to the same antigen. Okay, and once the monoclonal antibody binds, this causes the immune system to attack the cancer cell. It's like this is HER2 receptor. When Herceptin binds, then immune system gets activated and it comes all these killer cells will come and kill the tumor cells. Okay. So there are monoclonal antibodies in immunoprevention also. So we have antibodies against HPV, EBV, experimental antibodies, which can be given preventatively to prevent virus-induced cancers. Checkpoint blockade antibodies can also be given when the cancer is just developing, or if the person has high chance of developing a cancer. Okay, these HER2 antibodies, if there is a family history of that, you can give it in advance before the cancer develops. Okay, anti-inflammatory antibodies, there are many inflammation-driven cancer. We know inflammation gives rise to cancer. So you can give anti-inflammatory therapy in advance. You can give aspirin. I mean, aspirin is just very small thing, but you can give stronger prescription medicines for anti-inflammation in advance. That is also preventative thing for cancer. Okay. If it is just becoming precancerous, you can give ADCC, killing of early clones. Remember, antibody binds and the whole immune system comes and attacks it. So that's what you can do early on, before cancer is actually there. Okay. So there are many ways to target it. Okay. You can give antibodies bind to radioactivity. Basically, all the things you give it in therapy, you can preemptively give to the patient to prevent the therapy, to prevent it. Except, when the cancer is there, you don't give aspirin to the patient, because by that time aspirin is not going to work. But there are many other things which will still work. Okay, so that's the whole thing. You can give immunotoxin, you can give cytokines, you can give radioactivity. Okay, so that's all about monoclonal antibodies in immunopreventions. Now let's come to adjuvants in immunoprevention. So what is adjuvant therapy? Can you remind me? After the main thing. Okay, so you can actually give adjuvants in immunoprevention. I'll tell you what it means is that. So when you give preventive vaccine many times, it does not, so oftentimes the neoantigen may not be very immunogenic. Okay, so suppose there is a protein, right? So this part will trigger an immune response, but this part will not trigger an immune response. So some parts are recognized by immune system, like really they will respond to that part, but they will not respond to some other part. So this part is weakly immunogenic, this part is strongly immunogenic. Okay, so if your neoantigen is weak, then it is not going to work. Or suppose you are even giving a vaccine. Why are you giving a vaccine? To turn on the immune response. And if the vaccine is not turning on the immune response, it is useless. You are adding oncolytic virus, but the virus itself is cleaned up by the immune system, right? You want vaccine to go there and body to really strongly react and trigger immune response. So sometimes you add adjuvants. These are just some compounds that you add. When you add them together with the vaccine, the immune system reacts very strongly. That's all it is. So you give very little vaccine, but you mix it with some small molecules, and the immune system will strongly respond and make antibodies against it. That's all it is. So preventive vaccine without adjuvant often has weak immune response, low efficacy, but if you mix it with adjuvant, strong, durable, targeted immunity, and you can prevent this. So what these are, adjuvants are substances added to vaccines to enhance the body's immune response against a specific disease, which makes the vaccines more effective. Okay, adjuvants are critical in immunoprevention because preventive vaccines often target self-like tumor antigens which are weakly immunogenic. So if you add adjuvants, they wake up the immune system to recognize even when the tumor is full blown, it is easy to recognize. But you are doing preventive here. So preventive may be very little tumor cells, but so that's when immune system has to be super vigilant to find whatever is hiding there. So that's why adjuvant addition helps in vaccines. Okay, so vaccines and adjuvants, they alleviate the problem of limited vaccine supply, because now you have to use limited vaccine, because small amount of vaccine will work because you have added the adjuvant. enabling a more rapid immune response, antibody increase the magnitude, developing vaccine for effective T cell. Okay, so this is much better. All right, we know chronic inflammation is bad. Okay, so so whenever there is inflammation, there is a risk to develop cancer. Chronic, not just simple inflammation. So blocking pro-inflammatory cytokines. So there are cytokines which are released when there is inflammation. If you clean it up, they cannot damage it. Okay. Then inflammation takes the immune cells and make them immunosuppressive. So which are supposed to clean up the tumor cells? They are the one which are promoting tumor. So if you clean up that, you can add compounds. Remember I told you about the STING pathway. So if you give the activators, you can prevent the cells from becoming immunosuppressive. Okay, so you are preemptively trying to make the, you are preventing the tumor to make a tumor suppressive environment. You are giving the drugs so that there is immune system is fully active. Okay, neutrophils can lead to inflammation. You can target that. You can obviously use PD-L1 therapy because PD-L1 therapy is waking up the immune system. Okay, and microbiome also, tobacco smoke alters the lung microbiome. So you have to really make sure that in such case, and which promotes inflammation. So microbiome modulation is also an emerging area. Okay, and oftentimes we use combination therapy, vaccine with PD-L1 therapy or vaccine with anti-inflammatory drugs. Okay, all right. Prophylactic surgery. So the most common one is that bilateral mastectomy. You remove both breasts. Okay, these happens with BRCA1, BRCA2 mutations. This surgery is to remove ovaries and fallopian tubes. People with BRCA1, BRCA2, high chance of cancer. So you remove the ovaries. See, they appear pretty simple to do that. In some people, there is no side effect. But I know of a lady who had both of her breasts removed and she's in the hospital every 2 months for a month. So she will be in the hospital for 1 month. For 2 months later, she's back in the hospital because they just messed it up. So there is some infection or the other. So 4 months every year she spends in the hospital. Okay, so surgery also comes with its own risk. Okay, especially if the doctor is not very good. Okay, you guys may have heard of thyroid gland removal, right? How many of you have heard of that? All of you. So let me tell you a bad story about this thing too. So like levothyroxine we take for thyroid. So I had a colleague in my department in chemistry. So she had hypo or hyperthyroid something. So she was totally fine, no health issue, in her 40s. And they told her to get this irradiated so that it is not working. And they said you have to take levothyroxine for the rest of your life and that's it. So she was joking that I will buy this big bottle of levothyroxine because I have to take it for life. So she was planning her surgery on November and December. So I said, I can take all the classes while you are in the hospital. So I have no problem in taking the classes in your absence, her classes. So she said, no, don't worry about it. I have made the plan. Students will present papers during that time. So you don't have to worry. Completely healthy lady, just like no problem, absolutely no problem. They did the irradiation there and the irradiation went for whatever time that caused cancer. X-ray, radiation can cause cancer. 6 months later, she was dead. So basically the doctors killed a completely healthy woman. Okay, so one has to be cautious when they are doing the preventive thing too, because that can be very bad. So if the doctors are telling you something, you guys are scientists, read about it. Okay, don't let the doctor drive your wagon. Okay, all right, so I'm quickly going to give you some cases. Go ahead.
BRCA1, BRCA2 mutation generally is in all the cells of the body when it's inherited. Then why it is it shows more percentage of breast and ovarian cancer compared to other cancer. Like it is the DNA repair mechanism. No?
So BRCA1, BRCA2 also is expressed in many other cancer. Prostate cancer, a high percentage of BRCA1, BRCA2 is there. So, but it is not present in all other cancers. So it is possible that those other cancers have other repair mechanisms. They upregulate other repair mechanisms. So it could be some pathway which is still intact in those cancers, and breast cancer and ovarian cancer and prostate cancer really depends on BRCA1, BRCA2 pathway. So that may be more susceptible to it. Because it makes sense, if they have BRCA1, BRCA2, they should be prone to every cancer. But these cancers are more susceptible. There is another way to answer that. BRCA1, BRCA2. So remember I just told you, so yesterday I checked, so even if there is BRCA1, BRCA2 germline mutation, every cell of a body, it's one allele only, not double alleles. Okay, so in breast cancer, prostate cancer, ovarian cancer, and one other cancer, in this both BRCA genes are deleted. So it is these cancers which have both BRCA genes deleted, both copies of the genes deleted. So that's why they are more susceptible. I did not see any case yesterday where there was a germline mutation of both of them deleted. So is it making sense? So even if it is germline, you still have one copy of that. So they are still able to repair genes, but the tumor itself does not have a single copy. And these cancers, these two copies are deleted. Make sense? All right, so now I'm going to tell you some success stories using immunoprevention, right? So this is a real case about HPV vaccine. So if you give HPV vaccine, you prevent cervical cancer, okay? So in Sweden, when this vaccination was given to girls less than 17 years, 90% reduction in cervical cancer, okay? In Denmark, 86% reduction, huge reduction, right? US, 12 to 22%. It is possible that, it is not that prevalent there. I don't know why it is less in US, okay? But just see how much prevention is there. Okay, colorectal cancer, a dream coming true. So some cancers are highly aggressive cancer and they develop very quickly. They are there and then they are not there, and all of a sudden 1 month later they are full-blown cancer. This is one of the slowest growing cancer, colorectal cancer. It may take 10 years to develop, like really slow. So the good news is that one can catch it at an early stage, and when you catch it at the early stage, you can fix it. So immunoprevention therapies work extremely well in colorectal cancer. Okay, so there are drugs and you can catch them at early stage and you can prevent this cancer. Okay, then breast cancer, HER2 immunopreventions. So if someone has family history and it is likely that they have HER2, then you can prevent it before it actually develops into a cancer. Okay, high risk women, family history, and BRCA mutations may benefit from preventive strategy, including HER2. So there are different kinds of vaccine against HER2. It's a very famous target, right? So vaccination before the cancer onset in genetically susceptible women, you can give immunotherapy in advance to really boost up the whole immunoresponse there. Liver cancer, like HBV virus, leads to Hep B virus, Hep C virus. So you can give vaccine in advance, liver cancer will not develop. So that's a very good one. Okay, lung cancer, obviously whenever there is lung cancer, smoking comes into picture. So lung cancer remains the leading cause of cancer death worldwide, largely driven by tobacco exposure, chronic inflammation. Okay, so immunoprevention. So if you can inhibit chronic inflammation, you reduce the chance of cancer. And then because lung cancer is so prevalent, they know a lot of neoantigens. So you can make vaccines against neoantigens and you can give it in advance. and you can prevent that disease. Okay, so that is another way to reduce that. So immunoprevention is proactive. Vaccines, antibodies, immune modulations are key. So remember, it is immunoprevention, not prevention. If it was just prevention of cancer, I would say eat healthy, exercise, don't drink alcohol, all of those things. Okay, that's it. Okay, so it's 11:30.